Good afternoon, I'm Alan Unell, and this series of videos is Healthcare Advocacy, where we address problems in the healthcare system and then take actions to make a better system for all of us. We have a lot of topics to cover today, including, get this, electronic vehicles and health. Before we get to it though, down below in the YouTube description box, you'll find a link to the Healthcare Advocacy newsletter, which is the text for today's video. In there, you'll find links to medical studies, news articles, references for how to contact elected officials, organizations that support universal health care, what to do if you need an abortion, how to fight a denied medical claim, all kinds of stuff. And you can subscribe for free because I already had a job and that was a long time ago. Okay, so let's first talk about pollution and health. A new study from the University of Toronto's Engineering Department of Civil and Mineral Engineering suggests that large-scale adoption of electronic vehicles could lead to significant population-level health benefits. Now, the team used computer simulations to show that aggressive electrification of the United States vehicle fleet, coupled with an ambitious rollout of renewable electricity generation, could result in health benefits worth, get this, between $84 billion and $188 billion by 2050. Even scenarios with less aggressive grid decarbonization mostly predicted health benefits running into the tens of billions of dollars. The study is published in PNAS, and there's actually a link to the study in the newsletter. You can go read it. Now look, carbon dioxide is not the only thing that comes out of a tailpipe of an internal combustion engine. And while that affects the change in climate, we have to also be aware that tailpipes produce lots of air pollutants that have significant quantifiable impacts on our health. The team used their previous expertise in life cycle assessment to build a computer model, several computer models that simulated the impact of large-scale EV adoption. They adapted their models to simulate the production of air pollutants common in the fossil fuel combustion, such as nitrogen oxides, there are several of those, sulfur oxides, and small particles known as, I think they're called PM2.5. This is according to a study at the University of Toronto. I mentioned that, and in the newsletter, there's a link to their news report on this. I want to point out one other thing. When I was looking at this article, it occurred to me that not everybody on the article was a University of Toronto scientist. They actually had one person on the investigation team who was an employee of Aramco, A-R-A-M-C-O. If you're not familiar, that's the Saudi royal family's oil company. It's the only oil company in Saudi Arabia, and even they are pointed towards electrification. Just pay attention. Now, let me tell you something. My wife and I live in Vancouver, Washington. We have an electric vehicle. We happen to have a Tesla. We have solar panels on our home. And I got to tell you, we save a fortune. I mean, forget the health part. We're just saving a fortune. Essentially, we have no charge for running the car, no utility bills for 6 months out of the year, none. And we have no methane in our house either. Okay, let's talk about breast cancer and Medicaid, because I got to tell you, this study reinforces kind of what is intuitively obvious. And we should never go with what's intuitively obvious. We always need facts and data, because truly we can be wrong. So, but this one points us in the right direction. Medicaid expansion has been linked to improved care and increased survival rates for patients with stage 3 hormone receptor negative and HER2 positive breast cancer, according to a study that was published in the Journal of National Comprehensive Network. A related study compared direct and indirect costs of breast cancer and associated implications found that the United States had the highest cost compared with all Western European countries and Canada. And there are links to both of those studies in the newsletter. Now, let me give you some background. Medicaid expansion allows adults with income up to 138% of the poverty level, which is about $20,780 for an individual, $35,630 for a family of 3 for a year, to receive Medicaid coverage. Most states have adopted Medicaid expansion, going up to that 1.38 times the federal poverty limit, but 10 have not. Research has found that an increase in coverage results in healthier and more financially secure patients when they have Medicaid. The researchers evaluated the association of Medicaid expansion with the receipt of guideline concordant treatment for breast cancer, time to treatment initiation, you got to get in there fast, right? And 2-year overall survival among non-elderly women with newly diagnosed HR negative and HER2 positive breast cancer. They utilized data from the National Cancer Database, which a hospital-based cancer registry in the U.S. that is combined with the American College of Surgeons and the American Cancer Society. Participants included women between 18 and 62 who got that kind of diagnosis between 2010 and 2018. There were, get this, 31,401 patients with HR negative and HER2 plus breast cancer, 19,248 living in Medicaid expansion states, 12,153 in non-expansion states. Patients living in non-expansion states had an increased likelihood of being racial or ethnic minorities as well, 36.2% versus 32%. Patients in non-expansion states were more likely to be uninsured, 6.4% versus 2.4%. They live in lower income regions, 9.5% versus 5.7%, and non-metropolitan areas, rural areas, 14.5% versus 9.5%, and were not treated at academic cancer programs, 29.1% versus 35%, compared with patients in the expansion states. The number of uninsured patients decreased more in expansion states compared with non-expansion states, 3.2% compared to 1.9% versus 6.5% to 6.3%. Following Medicaid expansion, the 2-year survival rate increased from 93.9% to 95%. The improvement was greatest among patients newly diagnosed with the stage 3 disease who experienced a 3.81% percentage point increase. There was also a 0.5 percentage point increase in the receipt of guideline concordant treatment with Medicaid expansion. So we were more likely to be advised what to do if you were diagnosed. Medicaid expansion was linked to both initiation of guideline concordant treatment for less than 60 days from diagnosis, which is also important. That is, you're getting the information quickly that you have to go do something. This reinforces the important role Medicaid expansion plays in ensuring that women newly diagnosed with HR negative or HER2 positive breast cancer have equitable access to the healthcare services they need, especially when prognosis depends on access to treatment. Expanding insurance coverage to individuals with cancer allows them to have the benefit of access to life-saving treatment, according to the study authors. And it's in the AJMC, and you can find it there in the newsletter. There's a link. Look, read the other way, denying access to care easily leads to a death sentence. How does that sound? Not good. Having access to health care saved lives. How about if we all had access to health care? Let's take an action on this. Let's let our elected representatives know about this study. Early detection saved lives. Having access to medical care allows for early detection. It is that simple. Expanding Medicaid is a start. Look, it would be far better to have universal health care. You can reach your representatives at www.usa.gov/elected-officials I'll put that link in the YouTube box down at the bottom. Or you can use ResistBot on your cell phone. All you have to do is send a text message, sign, SIGN, space, PQYHNC. Sign PQYHNC to 50409, and they will take your information and make sure it goes to your elected representatives as an email. Here's the message you'll send. I'm your constituent. I want you to know that when cancer is involved, early detection and treatment make the difference between life and death. A recent study found that in states that have expanded Medicaid, more women have cancer detected and treated, and their prognosis is significantly better than women in states who have not expanded Medicaid. And I include a link to the study, and they can find that in the email. Their legislative analysts should look at that. What really saves lives is having access to health care. Even if Medicaid were expanded to the 10 states that have avoided it, there are still going to be tens of millions of us who make too much money for Medicaid and can't afford health care. It is a sad state. The real answer is H.R. 3421, the vastly improved Medicare for All Act. I want you to actively support that and really help all of your constituents. Thank you. I have a bonus action for you. Today is October 29th, 2024. I want you to vote accordingly, up and down the ballot, for people who will protect our rights and make lying wrong again. Indivisible, make sure you vote. That's what I've got for you. Down below in the YouTube description box, you can like, share, subscribe, send me comments. I will answer them as quickly as I can. You can also contact me at healthcareadvocacy1, all one word, at gmail.com. Something you want me to research, let me know. I'll do it. Have a good evening.